Madelyn Fitzgibbons. There's a less than 3% chance that a child in the foster care system will receive a college degree at any point in their life, stated by Brandon Gailey, CEO of By Reputation and Foster Care Advocate, from the report published by the National Youth Foster Institute in May 2017. According to a survey I conducted, everyone in this room feels that their basic needs are met with little to no barriers. Imagine not knowing where your next meal is coming from, or if you would have a safe place to sleep that night. This is how hundreds of thousands of kids in the foster system feel each day. The United States Department of Health and Human Services needs to better meet the individual needs of children placed in foster care. First, I'll discuss the problems within the foster care system, and then I will provide some solutions to these problems. Austin McGuire, head of the Clinical Child Psychology Program at the University of Kansas, reported in the Science Direct in 2018 that youth with a history of maltreatment are scientifically proven to have lower academic scores and have more trouble focusing within the classroom. Only 50% of children within foster care earn a high school degree before they leave foster care. A lot of this comes from not having a steady home or feeling like they belong. Children move from house to house, which often means moving from school to school. This has a lot to do with their lack of focus because they have difficulty forming relationships with their students as well as their teachers when they're moving so often. They are also more worried about other things than their education. Maltreatment is a huge problem within the system. According to Dr. Holly Hendrickson, who's a family physician who graduated from Brown University, as proposed in the National Conservation of State Legislator Journal in 2015, that in 2014, 1,600 children within the system were abused or neglected. These kids are more worried about being hurt by these people that are supposed to be taking care of them than they are about their education. Another glaring issue within the system is how children are aging out. Elizabeth Ahman, who has a master's in pediatric nursing from the University of Denver, claims in her journal, Supporting Youth Aging Out of the Foster System, published in 2017, that according to a study she did, 41% of the children who age out of the system do not have the funds to meet their basic needs. Unfortunately, a lot of these people who take in these kids do not intend on being their parent for life. After 18, 20% of these kids become homeless instantly. Without education and guidance, these kids become desperate for survival and turn to things like dealing drugs, joining gangs, and engaging in prostitution to find ways to make money. Dr. Jeanette M. Sheed, professor of psychiatry at the Michigan State University, reported in the Donaldson Adoption Institute, published in 2016, that these kids are ill-equipped due to trauma exposure to be out on their own, and that we need to guide them, and it's unfair to expect children who've been exposed to this kind of trauma to function normally. The next issue I'll be discussing is sex trafficking. 60% of victims of child sex trafficking have history within the welfare system. The average age of someone subject to this is 12. A recruiting tactic that most sex traffickers use is they send one of their people into group homes filled with foster care kids and convince them to run away with them and how much better their life will be if they come with them. These kids feel like they do not have a place that they belong, and this seems like a good idea to them. Unfortunately, many girls fall for this and are often never seen again. Now that I have talked about the problems within the system, I'll move on to solutions. We need to do better screening to make sure that these families taking in these kids are well equipped and have the best intentions. It's also important to make sure that a child fits in well with a family. Not everyone fits well together, and that often creates problems for these kids. Jeffrey Wade, assistant professor at the U of M School of Social Work, stated that culturally informed and support services should be available for foster providers. Another program that has been started to combat this is the Family and Youth Initiative in Washington, D.C. They have started forming positive adult relationships with these children by pairing them with volunteer mentors to better help them have positive adult relationships to guide them throughout their adult life. These kids are paired at the age of 12 and often will keep these relationships for their entire life. We need to start more programs like this to help guide these kids to have better, successful futures. First, I discussed the problems within the system, and then I provided some solutions. The United States Department of Health and Human Services should better meet the individual needs of these children in foster care. Reforming the foster system will benefit both the families fostering the kids as well as the children within the system. These kids deserve a better chance at a successful future than 3%.
5.